My name is Kevin Kaplan. I'm an orthopedic surgeon at the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. Here at the Healthy Center for Living at the YMCA and teaching patients and weekend warriors about shoulder injuries and what things to look for and how we treat shoulder injuries. Shoulder injury, the shoulder is a very complex area, and it's not always actual shoulder pathology that's causing the problem. It can come from your neck, it can radiate from different places, and there are a lot of different parts to your shoulder that can cause problems, whether it's your rotator cuff or the cartilage or your bicep tendon. So we need to take a 20,000 foot view at a patient to try to figure out what's wrong and where the pain is really coming from. So you got to take a 20,000 foot view when patients come in and tell you they have shoulder pain, even though they may try to convince you that, hey doc, it's my shoulder, it's not my neck. I got to take a step back and look at everything. And I do that through examination. I do that through a specific radiographic test and then come up with a treatment. So what are the symptoms that we are looking for in the shoulder, okay? Clicking, popping in the shoulder. Persistent pain. Doc, it hurts when I try to put the plates away in my cupboard. It hurts when I raise my hand up. It hurts when I reach back behind me in my car. Pain that keeps you from sleeping. Man, I cannot sleep on my right side. It wakes me up and bags on their eyes and man, you haven't slept in a week or 2 weeks. So that's something you want to get checked out. Stiffness or the inability to raise your arm. Numbness, tingling, and burning. Those may not be from the shoulder, they may be from something else. So this is a basic breakdown of the bony structures in the shoulder. Okay, so you have the ball here, which is the humerus bone, and you have the socket here, which is part of the shoulder blade, and then you have your clavicle, which is your collarbone, and that also meets up with the shoulder blade in what's called the AC joint. But I always start higher, right? I said things could come from somewhere else. So you gotta look at the neck, cervical spine. Everything starts from your brain. In order for me to raise my arm and point to things, my brain's gotta send a message to my nerves, and the nerves come down the spinal cord and they go out and they allow me to fire my muscles. So an impingement or something that's pushing on the nerve, because those nerves make up what's called the brachial plexus, and the brachial plexus is how we do everything. It's how I do this, it's how I move all of my muscles in my arm. And if I have something pushing on one of those nerve roots, which is what come right out of the cervical spine, then my brain may take that as a quote unquote shoulder pain, and it may be referred to the shoulder. Some people come in and say, I have pain in my fingers. I can't move my fingers and I got weakness. I go to turn something and it drops out of my hand. That immediately I'll think of, okay, we gotta look really high, because if I start thinking, okay, maybe this is a carpal tunnel, you could potentially miss something up in the neck. So you can look online for information at www.joi.net or my website, kevinkaplanmd.com. There's a lot of information about shoulder injuries and different things that you can do to treat shoulder pain prior to seeking medical attention. But if you have pain in your shoulder that doesn't get better, pain that's waking you up at night, pain when you're lifting your arm over your head, clicking and popping, get some help and come in and see us at JOI, and we'd be happy to treat your symptoms.